There was a lot of consultation that were made, and one thing came out clearly, that there was a gap in terms of psychosocial therapy to be able to look at them holistically when they come to the centers.
Before, as a senior nursing officer, most of the time I come in directly contact with them. When they come, sometimes I'll be at a funny position as a senior nursing officer. We lose some of the evidence. Sometimes I will not even know the lab, the most important lab investigation I'm supposed to carry.
I came across a child who has been beaten by the mother and also has been abused. But then I don't know that this case should be reported to the police. That case has been gone. We don't know anything about the case again.
I have been seeing these cases since I started working at Canifing without any proper knowledge of what is supposed to be the right way of doing things.
As a result of the challenges that we face, the midwife giving chair to the GBV, ranging from the psychosocial support, the counseling, we decided to conduct this training, being able to give this counseling now properly, also to fill the forms that were available with us properly, and also to counsel this patient and give the best treatment care that they deserve to get at the end of the day when they face us in our facility.
So this is the session 2. The first one we are dealing with was just the session 1. At the first visit, what they do. Second visit is almost similar, and then but this is the time you discuss the mental health issue. Whether mentally they are stable, they are having avoidance, what is the problem. I do remember session 3 we said where you write the hierarchy and start to give them assignments and all that. So you should assure them that they are not getting mad. Those thinkings they are having, those thoughts is a reaction, possible reaction for rape. And so you should explain to them and validate it that, look, this is what is expected. You can react this way, you can react that way. And so don't worry about it.
In a society that we are, as Gambians, it is very difficult for a woman or a girl to say I was raped, I was molested. Because for us, being a virgin is very important until marriage. So even though there's a 20% chance of a woman not having a hymen at birth, but we're yet to understand that. So some cases, the rapist or the perpetrator might be sick with hepatitis, with HIV, or might leave you pregnant. So it is not only what you give when you rape, it is what you take and what you leave. It is bigger than we think. It is deeper, it goes deeper. They need psychosocial support. We have to stop the stigmatization. It's very easy for people to sit in their houses and say, it's a lie, she was not raped. No, we don't know. We do not know. So let us give them the benefit of the doubt so that they can be back into society as they are supposed to be.
This training has given me much information. I'm very confident to face them, give them the health talk, the psychological support, the treatment and everything they need. And the next focal person, in case if to call the police or anything, we have been aware about that.
Coming to this training has enlightened me widely, and then hopefully from that I'll be able to manage them better and be able to provide the survivors a better service, and then be able to help them express themselves better, and then be able to get more information out of them than I was able to before I got the training. Record as much information as possible regarding the incident. In the case of a rape, it could be a domestic violence also. So please, that is also one of the thing we will need to discuss here. We have got the registers, the physical registers, for those of you who are implementing. From here, we want to have a uniform way of reporting. So that is also important.
Well, we've learned so many things. One of the models is forensic evidence data collection. So like it shows us how to take data and then also how to manage the data and then take samples in a sequence and then in a correct manner, labeled and packed, and then put into the right hands for it to reach the right place so that it won't be tampered on the way.
Substance abuse. You realize that some people, when they go through stress, they think substance abuse is going to reduce their stress. When you go some traumatic problems, you think, okay, let me take some substance so that I can rest, so that I can relax. And then eventually you may get addicted to some of these things and they become another problem for you. In a nutshell, all the things that we talk about since from yesterday are some of the health consequences they go through and how do we manage them. We talk about infection, we want to prevent infection. HIV, we want to make sure that they don't get infected. Pregnancy, we want to make sure they don't want to get pregnant if they don't desire to. All these things are part of our treatment plans. So we have to be very careful and know that all these things can happen. So when people come to us, we have to be careful and be observant of all these things that they can happen.
Now we know abrasion, we know bruises, and then how we should also handle their medical examination, their records, the continuity from a referral stage to another, handing over of samples of gender-based violence. It was just all learned in this 4 days forum. Gender-based violence, people should know it shouldn't be done. We should put a stop to it.